I am.
Nice
Hi,
to
nice
meet
to meet
you.
you. Alright. Thanks for having me.
Yes, thanks for coming and talking with me today.
Of course.
Okay, so let's just start out by telling me about yourself.
Sure. My name is Jen. I am from Grand Rapids. I went to Kalamazoo College and got a chemistry degree. Ended up working at the hospital in Grand Rapids as a phlebotomist, and ended up really liking the aspect of nursing. And I worked third shift, and I got to know a lot of nurses. So I talked to a lot of them and looked up accelerated nursing programs. Ended up applying to an accelerated nursing program, and now am in nursing, hopefully. So I also come from a really big family, and so I am very, I'm very close to everyone. I am an older sister, so I have a very nurturing, caregiver side, and I think that kind of plays a role in why I want to do nursing.
Yeah.
And yeah, that's a little bit about me.
Okay. Okay, so what do you find rewarding about nursing and about the job specifically?
So when I was working as a phlebotomist, I was drawing all these different patients, and I was working at night, and I was meeting all ages, because I worked in the adult population as well as the children's. And when I went into the children's hospital, I went to work with this one child who, when I was waking him up, he had his one request is for his nurse. And in that moment, I realized how powerful it would be to be a nurse, especially for that, that 5 or 6 or 7-year-old who's all alone and doesn't know what's going on, is kind of scared. I was kind of forever changed, and that's kind of why I want to be a nurse.
Yeah.
So I find that very rewarding, to just make someone's illness or condition a little bit easier for them. I also think it's really cool how we, as nurses, get to know all these different types of people.
Yeah.
I really appreciate the fact that I've learned that these people are more than just their illness. It's not just, what they're going through. They have a whole history and memories to share. So I find that really interesting, and I really like the adult population because of that reason. Because I really get to know the person and not just why they're sick.
Yes. So how would you deal with someone who isn't satisfied with your care?
So I'm not a very confrontational person, but I guess it would depend on the patient's behavior. So if they were okay with me being in the room, I would want to know what's going on, what I can change, what I want to fix. But if they're very aggressive or rude or don't want me in the room at all, I would probably end up finding a new nurse for them. Because if my care is not working for them, that's totally okay. I've learned that it's not always personal. So it would be really important for me to view that in a professional perspective, because I think that, they're sick, they're in the hospital, sometimes it's just a bad day and they don't want my care, and I understand that. So I would probably find a new nurse to help them, and then just take it in professionally and figure out what I need to change as a nurse, but not let it affect me personally. I think that's important for me.
Yeah, I agree. Tell me what you feel your greatest skill as a nurse is.
Well, I'm still a student, so those nursing skills, I think I will still be developing. The one thing I do think that I have a skill of right now is being really attentive. I'm very detail oriented and thorough, so it's important to me that I know what I am doing before I do it. So giving a blood pressure medication, it's important for me to know their blood pressure, or any type of medication. I'm not just going to throw it at them if I don't know why they're taking it.
Yes.
So I think, being very thorough and detail oriented, because for me, that's how I would want a nurse to treat me if I were sick.
How do you handle stress of the job?
So I think for me to avoid becoming overly stressed, it's really important for me to organize my day right in the beginning of the shift. Kind of know when everyone's medications are due, what tasks need to be completed. I think that's a really good way for me to organize my day without becoming frazzled by, 5 or 6 p.m.
Yeah.
As for stress or emotional distress that happens within the job, I think it's really important for me to, again, not take it really personally if I don't have to, and to, find, if I'm not at work, be present at what I'm doing and not worrying about work or something that had happened, because if it's affecting my home life, then I think that can be more stressful.
Mm-hmm. Great. Are you comfortable working with others, such as like doctors and other nurses?
Yeah, of course. I think nursing is a very team oriented profession, and I think it's really important to get everyone's perspective. I'm very comfortable, well, I'm still learning to be very comfortable with doctors, and communicating with them and advocating for patients. With other nurses, I think it's extremely important to get them involved or to communicate with them when I don't have the answers. And I think it's also really important to be helpful to the PCTs or, patient transport or someone who isn't a nurse, because they all have jobs to do too, and I think those can be stressful. So in making sure that they're okay can also make the shift go a lot better. So I'm very comfortable with communicating with people.
What do you find is the hardest part about being a nurse or being a student nurse so far?
Hardest part. I think the hardest part as a student nurse, and I think as a nurse, would be to not have all the answers for someone, or to know the answers and not be able to tell someone because of my scope of practice, and I don't want to step out of it. As a student nurse in my preceptorship, I was with my preceptor, and we were talking to a family about one of their family members who was the patient and his condition, and why he had his leg amputated, or why he was in the hospital for 4 days or 4 weeks, excuse me. And these were all questions, and they just kept asking all these questions that my preceptor legally could not answer, even though she knew some of the answers. So I think that would be really hard to refrain from saying that stuff, even though, it'd be really hard to find a different way to answer their questions, because we all know, they're probably desperate to know, they want to help. And just kind of imagining that could be me in that situation, and I would want to tell my family member. So I would be empathetic, but it would be really difficult. So
yeah. So why do you want to work here?
I want to work here because I think it's a really great floor. I really like cardiology. I didn't think I liked it prior to my preceptorship, but after being on the unit and working with all these different patients with some form of heart issue, I think it's really interesting that everyone has a heart, you can't see it, and it's all their things happen so differently. Someone has chest pain, or someone has triple vessel disease, or some atherosclerosis. It all manifests itself differently, and I think that's really interesting because so many issues can come from the heart, and I want to keep learning about that. And I don't know, I really like the adult population, and I think it'd be a really great unit to build off of my foundation and to keep learning those different nursing skills and kind of just keep maintaining them. Yeah.
Would you say you're a team player?
Yes. I think that I can be independent, and I can, once I learn a good routine or I'm confident in something, I'm really good at following through with everything, but I know that I will never have all the answers, and I will be unsure about a few things, or many things, and I think it's really important to get that extra confidence or, you know, like, yes, you're doing the right thing, or no, you should do this from someone else. And I would expect my coworkers to do the same, to ask questions, and at the end of the day, it's for another person, a patient, and I think it's really important to get everyone's input. And like I said about, you know, the PCTs and patient transport, or, you know, environmental services, I think it's really important to help everyone out,
Yeah.
because, you know, like I said, at the end of the day, it's for the patient and whatever makes it easier.
Yes. So my final question for you is, why should we hire you?
I would like to think I'm a very dependable person. I am very consistent, and I'm very hardworking. For me, this is more of a passion. It's a job, but I don't view it so much as a job, because I genuinely want to help people. And I think that's one of the qualities about me that I kind of admire, and I think would really help me thrive in the nursing profession. And I also set really high standards for myself, and that could end up being a weakness for myself, but my high standards include being detail oriented, include being thorough, and include being very kind and caring towards the patients that I am helping. So.
All right, great. Well, I think we'd love to have you on this floor.
Thank you.
All right.
I appreciate it.
We'll get back to you, and
Thank you.
you're welcome.